And welcome back to All Business Media TV. I'm your host, Rick Delgado, and this is today's TV version of Psychiatry Today with our host, Dr. Scot Bay. Dr. Scott, welcome back, and how are you?
Thanks. I'm very good, Rick. Hopefully you're doing well as
I'm doing well as well. And if anybody's interested in reaching out to Dr. Scott, you can find him online. nfbhc.com is his website, or you can give him a call directly at 678-822-0250. But for today's show, which is a little bit different, a little bit of a departure, this is something we've done on the radio a bunch. When we do our weekly, show on the radio, Psychiatry Today, we're always open for live phone calls. And people call in and they ask their questions, and of course, you do your best to try and give them as much information as possible. But for today, we're going to be doing this on TV. So we've got a phone number that we've given out. We'll be expecting those calls to be coming in, and when we do, we'll start going to them. But before we do that, just tell everybody a little bit about yourself. Anybody who's not familiar with you, your work, and what you've been doing, and your work as a psychiatrist.
Exactly. Well, my name is Dr. Scot Bay, and I'm a psychiatrist from Roswell, Georgia. Back here today in my home state of New York with you, Rick Delgado from All Business Media, and for 25 years, I've been in the practice of psychiatry, and also for about 15 years, I've had a weekly podcast, and then just recently, the weekly podcast and the weekly live internet radio show with you, Rick. But the Psychiatry Today show for today, as Rick said, is here in the studio where we're going to take your phone calls. My main motivation and my goals for all of the Psychiatry Today programs, whether it's the podcast, the weekly call-in show, or tonight, is that I want to better inform the general public about mental health issues. One of the things that I've noticed in my career is that people have a lot of misunderstandings and myths and misconceptions about psychiatry and psychiatric treatment and mental health issues. And in my treating patients and talking with people, I realized that there's a lot people don't know and understand about mental health issues, a lot of very basic questions that people have. So it's my goal to better inform the general public about these things, to dispel and get rid of a lot of these myths and misconceptions, to promote better general knowledge about psychiatry and mental health in the general public. And also, very importantly, Rick, there is still a tremendous stigma that surrounds having a mental health diagnosis or need for treatment. And, that's getting better with each passing year, each passing generation. But that's another one of my main motivations and goals, is to reduce that stigma, and so people are more understanding and accepting of having a mental health issue and getting and needing help for it.
Well, I think one of the important things that you do as well is, and like you mentioned, you take time to educate, because I'm sure between the time you actually started practicing and today, there have been some changes, some things that have kind of evolved as people have found out, well, this actually now is not what we it used to be. It's almost like with eggs. They used to say, well, you don't eat the yolk, it's bad for you. But now they come back, science is proving, well, it's actually not that bad for you. You know what I mean? It's one of those things where as more information comes out, you get to kind of refine that information and that message and let people know that, okay, what you may have seen in a movie that could have been true 50 years ago, it's not true anymore, because here's what we've learned. You know what I mean?
Absolutely. Well, there have been a lot of changes and advances in the field of psychiatry and psychiatric treatment. There have been medications to treat psychiatric illness, for example, really only since the middle of the 20th century, and that's relatively new. So the medications have evolved. There are newer ones with fewer side effects that are more effective, but there's still a tremendous need in mental health for new and different and better treatments. Even with all the medicines that we have nowadays, about at least a third, if not 40-some% of people with mental health problems don't get the help that they need from the treatments we have. So we have to think of everything that we can do to help people feel better mentally and emotionally. Not just medication, but therapy, counseling, and not just sitting and talking to someone through what's going on in your life. There are all types of specific therapies that target certain specific types of symptoms.
Right.
And there's now a lot more research as to how things like diet and exercise affect mental health, what specific nutrients help improve mental health. So we have to take a very comprehensive approach to helping people with mental health issues.
Yeah, and there's a wide range of things that I've learned in just talking with you in terms of, realizing that, medication, as you've described, is there to actually, is meant to heal the brain, from the particular issue, which I never thought, I didn't think that was part of medication's, role when it comes to mental health. I just thought, okay, it's just to suppress something or keep somebody from acting a certain way. But, according to what you've been able to share, it's, it can be something that you're on for a limited amount of time to deal with an issue and make a repair that's needed.
Exactly. That's really a good place to start, Rick, when I talk about, well, what are the myths and misunderstandings and misconceptions? Psychiatric medication, that's one area that's ripe for a lot of misunderstanding. So, for example, someone has a very severe case of either depression or anxiety.
Right.
When do they need medication or not? This is just a very basic question. And it's something that comes up a lot. Well, many people get anxious and many people get depressed. Not everyone is ill or is diagnosed with an illness and needs pills. So how does all that work? And that's a good question. And the answer is when the symptoms are so severe that they literally disable the person from being able to function normally. They can't get things done at work. It impairs their social and family relationships.
Right.
Their quality of life is drastically deteriorated. So it becomes more than just every day, now and again, feeling a little down in the dumps or a little bit anxious or worried. It becomes to the point where it's so severe that it affects someone's level of functioning, quality of life. They're having very severe symptoms. This is what differentiates just feeling a little bad now and again from actually having an illness.
Right.
And there are physical symptoms associated along with these problems. People who are depressed and or severely anxious don't sleep well, they don't eat normally, they may have lots of other physical symptoms. People with anxiety especially always suffer some kind of physical symptoms.
Right. And there's a, let's face it, the last couple of days, there's been a heightened sense of anxiety in the country, regarding a certain incident that just happened down in Florida with another school shooting that happened, which is unfortunate.
Absolutely.
So there's that level of anxiety that people are now feeling because, it's a whole toxic kind of, mental mess that people are dealing with.
Right. And, we might be able to spend the entire rest of the show talking about that, Rick, but just to quickly finish my thought, if people have to take psychiatric medication, like you were saying before, it helps repair the brain.
Right.
If you think of any kind of psychiatric illness as a kind of a brain injury, it's not the same thing as a concussion or a tumor or a stroke. It's more of a chemical or hormonal brain injury. You can think of very, very severe stress in someone's life.
Right.
Surge of stress hormones, and that affects the brain in a negative way. And the medication is designed to help heal brain tissue, undo the damage done by the surge of stress hormones from all the stress.
Right.
So it's not just making someone dulled or blunted to whatever is going on with them in their life that led them to feel bad in the first place. It's actually helping brain tissue heal from the damage done by the stress. And if someone has just had one lifetime episode, it was very clear what triggered the episode, they can take medication for, say, 9 months a year and then stop. It's only certain people with certain psychiatric illnesses that are lifelong that will always come back over and over again, that they have to stay on medication to keep under control.
Okay. Well, you know what? We'll probably jump back into that. We've got our first caller.
We do. All right. Then let's get right
on the
to
telephone line. So let's go to that. Our caller, Kate, calling from Port Jefferson. Kate, are you there?
Hello?
Yeah, we can hear you.
Oh, okay, great. I have a question with regard to something that happened in our school district today.
Okay.
There was apparently what you could call a copycat for the Florida incident. There was a threat made against the school by a student, and the majority of parents kept their kids home. So I'd like to know how to explain that to my children. They're 11 and 14. And when I came home today, I was asked by my 11-year-old whether or not he was going to die. So how do I handle that with him?
Right. Well, thanks very much for calling with your question, Kate. Yeah, this is extremely difficult, and I've seen other people making comments in the media about, how do I talk my kids down off the shelf and off the ledge and convince them it's okay to go to school. I think basically, as your son's question demonstrates, children's main concern is their personal safety, and they're looking for their parents to assure them that everything will be okay. And I think the best thing you can do is to reassure your son that everything can and will be done to help them stay safe, and that you're not going to let anything bad happen to him. Now, having said that, one of the ways that people can cope with the trauma of what happened in Florida and how it affects all of us everywhere else in the country is to advocate for better safety measures and other things that could help prevent incidents like this from happening. But to answer your question more directly, it's to just reassure him, no, you're not going to die. I'm not going to let anything bad happen to you. And we're going to also talk to the people at your school, make sure they're doing their job. I think that if there is a parent-teacher association or other such group at your child's school, it would be good to touch bases with them as to what's being done at the school. Are there going to be special assemblies for the children to let them air their fears and concerns and to try to alleviate them? Are there extra security measures that are going to be taken, or are the security measures that are already in place going to be reviewed and updated? So I think it starts with that conversation with your son at home, but I would also encourage you and everyone to take this opportunity to say, hey, what can and should be done and what more could be done to keep my child safe in school. But I would also expect, Kate, that you're probably going to have that conversation with your son repeatedly, even after he seems to be reassured and calmed down, hopefully. Likely as not, the question is going to come up over and over again, and I want to reassure you that that's normal. When there is a very severely stressful situation that kids are going through, it's normal for them to need repeated assurance and for them to bring it up repeatedly, even though they seem to have been reassured before. So I'm so sorry to hear that he's feeling that way, and I cannot imagine what you're going through, and hope that the situation calms down. But thanks for your call.
Thank you. Thank you very much. I appreciate your advice.
All right, thank you for your call. And yeah, and I think you've mentioned this before, too, Dr. Scott, when you're dealing with, because we've talked about this in the past, the schools, they step up. I know I heard it on the news that they were offering counseling to the children, right, who are affected by this down in that school, where they can go and talk to somebody over the weekend. They open up a separate center, and again, when we discussed it, I was like, well, how helpful is that? But I think as these things kind of unfold, you see how, even just the reassurance, I think, is a big thing, right?
Absolutely. When it comes to an incident like this, Rick, the mental health implications there are so many layers. If we look at the situation with the shooting in Florida and kind of start from the middle and work our way out.
Right.
So immediately, the first focus is going to be on the family members of those who lost loved ones.
Right.
Those people obviously are going to be completely devastated by grief and most likely anger and pain and loss beyond what any of us can imagine. So those folks certainly are going to very likely need mental health treatment, at least counseling. Again, if their functioning completely deteriorates, quite possibly medication as well.
Right.
And then you have the survivors of the attack. So when their physical wounds heal, then their emotional wounds will need attention.
Right.
I heard this described very well after the Las Vegas shooting. The mental health providers are like the second responders. The first responders are about saving life and limb,
Right.
and addressing the physical wounds. The second responders are about healing the emotional and psychological wounds that come up afterwards.
Right.
So the survivors of the attacks, they're going to most likely need mental health treatment for the trauma that they've gone through with what happened.
Right. Would this be considered PTSD?
Exactly. Someone who has witnessed a trauma this severe is definitely at very, very strong risk of post-traumatic stress disorder.
Okay.
So that they will have flashbacks of the incident. A flashback, for those of you who don't know, is when you have intense, vivid recall of some severe trauma that you've witnessed or gone through. People who have PTSD describe a flashback as if they're watching what's happening to them in front of them, as if it's on a video screen.
Right.
It's that vivid, it's that intense. And it's also common for people who have PTSD to have nightmares, either about the trauma itself or just other very severely frightening or horrific scenes in their dreams.
Right.
And then you have the people who maybe weren't injured in the shooting, but saw things happen as they were running away. So we've all heard and read in the news accounts of some students and teachers and other people who witnessed other people being injured or killed.
Right.
Just heart-wrenching accounts of one student watching a teacher selflessly throw himself in front of the shooter to shield some students. So a person witnessing something like that is also going to be subject to very, very severe trauma and have to deal with that the rest of their life. So they will likely need mental health counseling.
Okay. Well, you know what? I'm sure we could, like you said, we can go on and on with this. We do have another caller.
Let's get to that then.
Who's checking in. His name is Charles. He's from Austin, Texas. Charles, thank you for calling into Psychiatry Today with Dr. Scot Bay. What's your question?
Thanks for having me on first. I just wanted to talk to Dr. Scot Bay for a moment. I have a cousin that currently resides in Florida. I'm worried about his mental state of health because he was in the school that was recently shot up. I want to know what kind of conditions could potentially come out of a situation like that when somebody's just been through something traumatic like that. Right.
Well, thanks for your call, Charles. Yes, absolutely. When someone has been through a situation like that, the situation you worry about the most as far as specific conditions, like you're asking, is post-traumatic stress disorder, or PTSD. Many people think of combat veterans when you think of PTSD, but of course, any trauma can happen to a civilian and trigger that. The shooting in the school in Florida, a car accident, fire, flood, earthquake, what have you. So severe anxiety is the main thing that you want to look out for in this person you know who went through that. Extreme severe anxiety, sometimes panic attacks where a person is so anxious they can't breathe, their heart feels like it's about to pound out of your chest. And over time, the next few weeks, they might develop the symptoms we were just talking about. Nightmares about the incident, or if not about the specific shooting, just generally very, very frightening, disturbing dreams, flashbacks where they see the incident happening, vividly recalling it while they're awake. People who have been through trauma like that experience a symptom called psychic numbing. It means that they just don't have any emotional response to things that would normally trigger it. Typically, they would no longer be able to enjoy things they would typically enjoy. They may have also feelings of deep depression, anger, agitation, irritability. So these are the types of symptoms that someone who's exposed to severe trauma could have. The main important thing is to strongly encourage someone in the situation, like you're saying, Charles, encourage them to go talk to someone, because there is help for going through this type of trauma, talking through this with a therapist, preferably and especially someone who has specific expertise in dealing with trauma victims. There are special certifications that therapists may decide to go for so that they become expert in treating people with trauma. And so if they can find someone like that, so qualified to talk to, that would help a great deal. And, you know, but as we've been talking about, anyone involved in this incident, from people who witnessed it directly, people were hurt, the family members of people who were hurt, and then even people who did not witness it and weren't directly involved. You know, Kate, the person who called earlier, anyone who has a kid that they're going to send to school and they're worried about what's going to happen to their kid at school. Their kid is worried about what's going to happen. So there's a lot of layers of anxiety and stress that sort of progress from the center of a terrible, severe incident like that.
Right.
So I would just suggest, Charles, stay in close touch with this person, encourage them not to kind of withdraw into a shell and try to just wipe away and forget what happened to them. Instead, if it's clear that they're struggling, encourage them to go see someone and get help and talk to them about it. So thanks for your call. I wish them all the best.
Thank you, Doctor.
All right, Charles, thank you for your call. We appreciate it. And it's interesting, you know what, Doc, when you mention the different people that could be affected by you know, this particular incident, or really any incident. You could talk about a car crash, you know, where somebody saw somebody that they know, pass away in a car crash. It's just something horrific that to them they have trouble dealing with. But then you also have on the other side of the coin, you know, you also have the first responders who their job is to run towards these issues.
Exactly.
You know, they're probably going to have to deal with things at some point, right?
Right.
But also, what about that person that, you know, that strong silent type? You know, maybe a father, quote, figure who was, you know, I'm good. I'm gonna, you know, they helped kids out. They you know, tried to, you know, do what they could, and you know, but they're being, you know, you hear about all the time. This person's being lauded as a hero for pushing kids into a closet. You know, that they live too, but you know, and they come across as I got it all together. But at some point, that facade is going to need to be addressed, right? That issue. Absolutely.
Someone who has been through something like that, and again, you know, there were accounts of a teacher who did just that, and
right.
She was interviewed on the news. There are times when even if someone feels initially like they've been able to overcome it, you know, eventually the stress and the trauma and the anxiety will come out, and they will start to struggle and show symptoms.
Right.
So it is best for someone not to try to hold all that in and think they've got it all under control, but to say, hey, I really need to talk this through with someone.
Right.
Now, of course, another mental health implication of all this, and a question that I often get asked is, well, what about the shooter? You know, to me, the focus mainly needs to be on all the victims, not just those who lost their lives, those who were hurt, those who witnessed what happened,
right.
And you know, those who were affected by what happened. You know, but there are just a lot of things to do with people who commit these crimes, the signals that were missed, that there were definite problems, red flags that were overlooked. He was in treatment, and you know, that was discontinued when he lost a parent. And a lot of government officials will cite need for better attention to mental health issues when things like this happen. The problem there, as his case demonstrates, even if someone has been in treatment,
right.
There are too many ways for things to fall through the cracks.
Right.
And we live in a society where the mental health laws are structured so that unless and until someone does something too far to commit harm to others or themselves, they're not going to come to the attention of legal authorities.
Right.
And they're not going to be mandated into any treatment. It's going to still be voluntary. And as was seen in this case, when it was merely voluntary treatment, it stopped, and no one was diligent enough to make sure that he was still in treatment, and his condition obviously deteriorated to the point where he committed this horrific act.
Right. And unfortunately, like you said, there were red flags all over this for months, and nobody acted on it, which is disappointing to hear when these are the people we kind of entrust to kind of do these things. Again, we are dealing with a live version today of Psychiatry Today with Dr. Scot Bay. Of course, if you want to reach out to us, you can call us live. We're taking live calls right now. If not, if you want to find Dr. Scott on a later time, go to his website, nfbhc.com. That's nfbhc.com, or reach out to him at 678-822-0250 and reach out to him privately and see how he can help you. We've got our next caller, Dr. Scott.
Absolutely, let's go for
So
that.
why don't we go to that? It's coming from New Jersey, and our caller's name is Tracey. Tracey, what is your question for Dr. Scot Bay?
Hi, the medication I've been taking for my depression, it's not really helping me. And I know my grandfather had bipolar, and I'm starting to think that I might have it too. What do you think? Do you think that I was misdiagnosed with my medication? Do you think it's helping, or?
Okay, well, that's a very good question, Tracey. Thanks for your call. First, several things just in general about the issue, and then we'll get to your specific question. So when someone goes to a doctor and they need medication for depression, in my opinion, it's incumbent upon the doctor to ask about all other types of symptoms, not just to explore and understand the symptoms of the depression that the person is suffering from and needs help for. So even if someone never reports to me that they had any symptoms of bipolar disorder, which we used to call manic depressive illness, it means sometimes people's moods get too high or manic instead of too low. Instead of being sad and down and depressed, they get too hyper and excited and over-elated and euphoric. But if the doctor prescribing the medicine doesn't ask that question, then yes, as you say, it's possible that there could be a wrong diagnosis, and therefore, if you don't get the diagnosis right, like I always say, you're not going to get the treatment right, including the medication.
Right.
Now, your grandfather having a diagnosis of bipolar disorder does mean that with that lurking somewhere in your DNA, you could possibly have that tendency. We know from previous research that bipolar disorder does follow through family trees. In fact, it's of all the major psychiatric syndromes, it's the one that's most clearly genetically transmitted.
Really?
You know, we don't have specific genes and chromosomes that it's narrowed down to, but yes, you draw a family tree with people affected by bipolar disorder, and you can see that's very obvious.
Really? Okay.
Right. So to answer that part of your question, Tracey, yes, you're having a genetic relative who has bipolar disorder does put you somewhat more at risk. Now, in order to address your question more directly, I need to ask you some things. So have you ever before now had an episode where your mood got a little bit too hyper or high or agitated? Could be euphoria, could be elation that was excessive or out of control, or it could be extreme bouts of rage that were unreasonable. Has that ever happened to you?
Yes, and I would blank out sometimes.
Okay, right. So, and what was the reaction that you're having to the medication that you were concerned about, that it wasn't a good fit for you, the medicine?
Anxious. I feel anxious. I just don't feel like it's really working for me. I feel like it's making it worse.
Mm-hmm. Okay. Well, you know, it's very possible something isn't right as far as either the diagnosis maybe needs a closer look to make sure that you don't have some form or another of bipolar disorder. But at the bare minimum, at the very least, if your medication is making you feel worse instead of better, then obviously that's wrong and that needs to be addressed. So my suggestion would be that you go back to your doctor who's prescribing it for you review your family history, review your own history of symptoms, and make sure that the diagnosis has been investigated thoroughly and properly enough. Report the side effects that you're having from this medication, and hopefully your doctor will work with you to take a fresh look at your diagnosis, make sure they've got that right. And if there's still some doubt after having the conversation with you, he might be able to arrange for some testing with a psychologist who specializes in testing for psychiatric diagnosis to further refine what your diagnosis is. And in the meantime, adjust your medication, because clearly it sounds like it isn't working, and I agree with you, something needs to be different. And now I'll also tell you that I hope that your doctor will be willing and able to work through these issues with you. Unfortunately, I do hear a lot from patients of mine that they've tried this approach with other doctors and it hasn't worked. And if that does happen with you and your doctor and you kind of can't get on the same page, then I would encourage you to go get another opinion. And I'm so sorry you're having that trouble, Tracy. I hope the suggestions I gave you wind up being helpful, and I sincerely hope that you feel better soon.
All right. Thank you so much.
All right. Yeah, Tracy in New Jersey, thank you for your call. We appreciate it. And again, you know, when you're talking about medication, that's kind of a wide-ranging topic, right, Doc? Because,
right.
You know, you've got, I'm sure there are different medications that could be issued for each problem, right? So say the bipolar.
Absolutely.
And
right.
I'm sure it probably has to do not only with the medication, if it's the right one, but the dosage level, right? Is
Right.
that part of it?
Yes, all of those things. Mm-hmm. And, you know, I'm a very firm believer, and I preach this all the time, like I was telling Tracy, who just called. You have to get the diagnosis right to get the treatment right.
Right.
There are specific medicines that are for bipolar disorder, and there are specific medicines for just depression or unipolar mood disorders
Right.
that we don't give to people who are bipolar. So that's why it's so important. Get the diagnosis right. There are certain medicines for a certain diagnosis. And that's an important point, too, because I know it seems, unfortunately, to a lot of people like, well, you know, we just throw something at a situation and see if it sticks. That's not, in reality, how it's supposed to be.
Right.
You do hopefully, if you do it right, you're doing a refined, detailed, thorough diagnostic evaluation. You find out what is wrong with the patient, and then you know what treatments are the best for their condition.
Right. And part of that, too, is knowing what they've been doing prior, right? To get the full story. Like you said, to get the family history, too. Get that involved.
Exactly. I always get as detailed a family history of psychiatric illness as I can, and also a family history of people taking psychiatric medication. Because if someone comes to me and they have certain symptoms and they've had a genetic relative who had similar symptoms and
Right.
responded well to a given treatment, chances are that same medication will work for that patient.
Right. Now, what about triggering events, like, say, a car accident or a shooting or, you know, something traumatic? Can that kind of spur, like you said, she might have that bipolar running through her system, but maybe it's dormant. You know what I mean? And can something kind of trigger that to come out?
Yes, absolutely. I really feel like any mental health problem is a combination of genetic vulnerability to it and environmental stress. And when those combine, that's when people have an episode. And most typically, that's what will trigger someone's first lifetime episode.
Right.
And then, unfortunately, a lot of times, the illness will have recurrences, relapses. Eventually, it just takes on a life of its own, and people have episodes regardless of there being a specific stress that will trigger it. But yes, most typically, initially, someone's first lifetime episode will be triggered by a specific stressful event.
Right. Now once that first trigger or first time it happens, is it something where it may never happen again, or is it now it's exposed and now it has to be treated? And is that something like the bipolar, because it's running through the family, is that something she might have to experience being on medication for the rest of her life?
When it comes to bipolar disorder, of many psychiatric syndromes, that's one of the ones that we know.
Okay.
There will always be the risk of relapses and recurrences. And because with each new relapse and episode, it does further damage to the brain. Mm-hmm. I mean, over the lifetime of someone who's a sufferer of bipolar disorder, it can now be documented that certain areas of the brain shrink. You can document decreased volume of brain tissue in certain areas because each episode, either a mania episode or a depression episode, does physical damage to the brain.
Right.
So, and their functioning completely falls apart with each episode. They can lose their job, go through a divorce, lose their family, in worst case, become homeless.
Right.
So for that reason, someone with that disorder really needs to stay on medication for the whole rest of their life.
Right.
For someone with just unipolar depression, it's not as clear. To your point, say it could be one lifetime episode. It was triggered by a specific severe stressor. They overcome it. They have counseling and/or medication. They may be fine for the rest of their life.
Right.
But this is what we do know. After one lifetime episode of depression, someone has at least a 50% chance of a second.
Right.
After two, you've got about a 70 to 80% chance of having a third. And after three, you've got about a 90% chance of having a fourth. So at some point, you have to say, you know, the odds are turning against me in terms of this coming back again and again and again
Right.
to haunt me and make me feel awful.
Right.
So at some point, strong consideration has to be given for staying on medicine to prevent these recurrences.
Right. Now, in terms of the harm to the brain, I almost equate that to, you know, when somebody suffers an injury, maybe in an accident or something, and there's swelling around the brain and they induce a coma to kind of let all that, would that be kind of that same way that the way the medication is trying to work to heal the brain so you can, you know, kind of repair the damage?
Exactly. I call it a chemical or hormonal brain injury,
Okay.
as opposed to a physical one like a concussion or
Right.
a tumor or a stroke. Basically, what happens is when you have severe environmental stress, a breakup, being fired, fire, flood, earthquake, car accident, going through a school shooting, what have you,
Right.
that stress causes your hypothalamus to release corticotropin-releasing hormone. That causes your pituitary to release corticotropin-stimulating hormone. That goes to your adrenal glands to release cortisol, your main stress hormone. Cortisol is in circulation throughout your entire body. It increases the circulation of inflammatory proteins all over your body, does damage to multiple organs. And in the brain, it specifically targets a very small structure in the temporal lobe of the brain called the hippocampus. This is key in terms of memory, and it also has intimate connections with another small area of the brain called the amygdala. Together, these are the areas of the brain that process the emotional aspects of memory, whether it's trauma or, you know, stress, what have you.
Right.
So this is what I'm talking about when I'm saying I liken depression and stress and other adverse mental emotional states to a brain injury.
Right.
And the medication's job, it tells your brain cells to produce proteins that protect and nourish them and undo the damage done by all these stress hormones. So that, in a nutshell, is what I mean when I'm saying depression, anxiety, other adverse psychiatric illness states are like a brain injury, and medication helps the brain heal and repair itself.
Right. Well, you know what? We've got another caller.
All right.
So why
Let's
don't we
get to
go to
that.
that?
Yes.
Dr. Scott, our caller is from Queens, New York. His name is Vincent. Vincent, welcome to the show. And what's your question
Hello,
for
Dr.
Dr.
Scott.
Scott Bay?
Hi, Vincent.
Hello.
Yes.
Hi, how are you, sir?
Good.
Hi, I got a quick question. My doctor, he calls my depression, it's like treatment resistant, he says, right? And my medications, they keep changing, you know, and they're constantly taking new medications. Now, I'm interested to see if there's other means of possibly managing my depression. You know, someone mentioned cognitive behavior therapy, but I'm not exactly sure what it is. Could that help my depression? And like, should I discuss it further with my doctor?
Yes, absolutely, Vincent. So
Yeah?
cognitive behavioral therapy is a specific type of psychotherapy. When people think of psychotherapy or talk therapy, it's just sitting and talking with a therapist. And
Right.
that can be very helpful in terms of dealing with depression as well as most any kind of mental health problems. But cognitive behavioral therapy is a specific type of therapy. It's a specific technique, and a cognition is a thought, right? And the theory behind cognitive behavioral therapy is that negative thoughts lead to negative emotions. And therefore, if you can teach the person to counteract the negative thoughts with more positive ones, it will help with their mood. To give a very, very simple, basic example, many people who suffer from depression perceive themselves as being worthless or no good or a failure. That's a classic textbook symptoms of depression, someone having a low opinion of themselves. So in cognitive behavioral therapy, one thing you might do is teach the person to stop those negative thoughts about themselves and instead start to replace those negative thoughts with more positive self-talk, with more hopeful, positive thoughts. And by doing so, the negative depression and all those negative emotions start to melt away. And really, unlike most types of therapy that you think about and hear and read about, it's not typically something that's open-ended that goes on for years.
Right.
A typical course of cognitive behavioral therapy, on average, would be about 3 months. But again, even though I do think it would be helpful, especially since medication hasn't necessarily been helpful for you, it's important that you vet the qualifications of the therapist and make sure that they have adequate training and certification in cognitive behavioral therapy.
Right. All right. So, yeah, it's something I'm going to look into then. I didn't know how intense the therapy would be, you know, but, all right, doctor, thank you so much.
You're very welcome, Vincent. Best of luck to you. Hope you feel better.
All right, thank you so much. Take care.
All right, you too.
And Vincent, thank you for your call. We appreciate it here on Psychiatry Today with Dr. Scot Bay, of course, answering all your questions. Of course, we've got the phone lines open, so if anybody else wants to reach out to us, they can ask the questions. Now, talk to me about that cognitive...
Cognitive behavioral therapy, or CBT for short.
It just sounds,
right.
It sounds like trying to keep yourself in a positive frame of mind, right?
Exactly. Right.
And when you do that, are you releasing, you know, like, you know, you mentioned cortisol being probably not a good thing.
Stress hormones.
Right.
Right.
Would being, you know, trying to be more positive, trying to think of, you know, positive talk and like
right. I mean,
happy music, kind of get those you know, those things flowing in you to kind of feel better?
It would be fair to speculate that by adopting more positive approach, more positive attitude, counteracting and negating and moving away from the negative thoughts and negative self-talk, certainly that would help to enhance the flow of more positive chemicals in the brain. Some other things, speaking of more positive flow of chemicals that help you feel better mentally, emotionally, and physically, exercise. Exercise is another thing that Vincent or anyone who's had trouble with depression can do to help themselves feel better.
Right.
And just good basic self-care, avoid excesses of caffeine, really avoid alcohol. If your depression is that bad that the doctor is calling it treatment resistant, best to avoid that. Alcohol is a depressant, so even moderate amounts would be too much. And by the way, you know, Vincent raised the issue, he was saying treatment resistant. What does that mean? People who've tried 4 or more medicines for depression and struggled to feel well. Now, again, that means, in my opinion, were the trials of the medication carried out appropriately. I'm pretty picky about that. To me, a therapeutic trial of an antidepressant is the maximum dose someone could tolerate for, you know, at least 6 weeks. You know, was that done properly? Can't get into that much detail with Vincent, but that's another issue before you go labeling someone treatment-resistant depression, you know, where the medication's prescribed correctly and properly. But nonetheless, cognitive behavioral therapy could help him, as well as exercise. And also, he raised another important issue, the expense associated with going to see a therapist.
Okay.
It's terrible, it's a scandal, but having health insurance cover psychotherapy is still much more difficult than it should be.
Right.
And, you know, that's another problem. You know, people can get health insurance coverage for physical therapy if they have an orthopedic injury, but to go see a therapist for counseling to heal from anxiety or depression, which, again, like we've been talking about tonight, is a brain injury, why should that not be covered?
Right.
It ought to be.
All right. Well, hopefully it will be in the future. Right now, it's a struggle to get that coverage. We've got another caller for you, Dr. Scott. His name is Tommy. He's from upstate New York. Tommy, what's your question for Dr. Scott on Psychiatry Today?
Hey, Dr. Scott. I was recently diagnosed with bipolar 1 disorder, and I'm kind of worried that my children are going to be predisposed to it. How likely do you think it is that my children will suffer from this later in life?
Right. Okay, Tommy. Well, thanks for your call. Let me tell you the answer is about 20 to 25% risk when a parent has bipolar disorder that the children will also have it, right? So it's not a trivial risk, but it's certainly not a sure thing either. But what I will tell you is this. I think your best course of action, rather than to let yourself worry about, well, is this going to happen to my kids someday? Let's face it, you don't have any control over that, right? And I know it's easy for me to sit here and say that, but because you don't have any control over it, it's not really going to accomplish anything to worry about it. So instead, a more positive course of action to help your children with this issue, first and foremost, take good care of yourself. So make sure you're getting adequate treatment for your mood disorder so you feel at your best. If you're feeling at your best and you're keeping your mood stable, then of course, you're going to be the best father you can be to your children. Secondly, since you have the disorder yourself, you know what the symptoms are. So as you see your children grow and develop emotionally, if you see them start to have problems, don't wait until they get more severe. If you see and you know they're having difficulties with their emotions, the earlier you get them help, the better. And hopefully that won't happen, but let's say it does. And let's say they're unfortunately very young and you don't necessarily want to have them put on medication at a very young age. That's fine. Even if they start to show obvious mood symptoms at a young age, and understandably you don't want to have them get on medication, there are still child and adolescent therapists who can do some therapy with them, some counseling to help them learn better how to cope with their emotions and the difficulties that their mood disorder might give them. And so it's really all about just being proactive, knowing the signs, and that way you'll be able to help your children if and when any problems might develop.
Right.
So I hope that helps.
Yeah, definitely. So basically, would you recommend, even if I wasn't seeing any problems, would you recommend they see what I guess would be an adolescent psychologist to monitor the way they're developing?
That's a good question. Actually, I don't think you need to. I think as long as they're doing well enough in school, let's say academically, as long as they seem to be on a par academically and also socially with their peer group, and no one observing them or working with them sees any problems, then I don't think you have to go out of your way to have them treated. If they seem to be struggling in one area or another compared to their peer group, whether that's the other children in their classroom or in social spheres or situations, outside activities and groups and whatnot, then I think it would be time to have an assessment.
Okay, thanks a lot, Doctor. I really appreciate it.
You're welcome, Tommy.
Yeah,
Thanks for your question.
Yeah, and Tommy, thank you for your call. Again, a lot of the things that you're talking about, Doc, are things that most people probably don't think about, but then, something happens. Something happens either in the media or in their world, and all of a sudden they become, like this guy, he was diagnosed with it. So his immediate thought is, okay, how do I know if my kids are going to be affected? And one thing I think was helpful that you pointed out, that he knows what to look for. So I guess
Right.
that's a great way to kind of, okay, I see if it's going down this road. If you don't see it's going down that road, don't push it down that road. You know what I mean? Like stressing out about it is probably not going to help.
Exactly. Right. So that's why I just tell people, don't worry that it may happen to them. Just, number one, take good care of yourself so you can be the best parent you can be to them. And number two, if you see the signs, make sure they get help right away.
Right. And you also mentioned, for certain things, and it's probably helpful for everybody, really, is to get out, do a little exercise, because, getting that positive, that positive energy flowing in yourself, can help alleviate signs of depression, right?
Exactly. And, you raise a good point. The type of question that he asked and some of the other questions, these are just basic things about mental health and well-being, and there isn't enough information out there, and that's why I do this, because I want people to be able to have a source for information, to ask these questions, to get this information. It shouldn't be so difficult to find or get this information, and yet there's not enough of it out there, and not, in my opinion, not enough people with positive voices providing it. So that's a lot of what drives me to want to do this.
Yeah, and
so
a lot of
to be able to answer these questions.
And a lot of misinformation, too. I mean, a lot of what I know about it, and I think I've told you this before, Doc, comes from movies. I've seen One Flew Over the Cuckoo's Nest. I've seen Anger Management. Those. And it was funny because, now that I think about that movie Anger Management, with Adam Sandler, the whole time through the movie, he wasn't showing any anger, but I guess it was simmering down inside. But it was something that, a professional could notice, but us from the outside, we really don't see it because we don't know what to look for, right?
Absolutely, yes. I mean, there are a lot of things that people take from movies and the media and stereotypes, and this tends to foster a lot of myths and misconceptions and misunderstandings, and I feel like it's my goal to debunk a lot of these things so that people know and understand better, and not only to help themselves, Rick, but also to have more understanding for others around them who have mental health problems. Right. There's just tremendous, very negative treatment of people who have mental health problems and have psychiatric illness and need treatment. Right. And those types of negative stigma, negative stereotypes are extremely painful and difficult for those folks to deal with, and that's another reason that, I want to try to attack that problem and get rid of those negative myths and stereotypes and that stigma. And
another part of that anxiety equation, I think, probably stems from, technology as well, because as things are evolving, people are more connected. And people love bad news, and bad news travels. If it bleeds, it leads. If it's in the media, Doc, I've been doing this for a long time, and I know as well as anybody, if it bleeds, it leads. They always go with the bad news. There's nobody who focuses on, hey, who did something great today? Let's talk about that in the news,
Exactly. And to your point, there are more and more research studies coming out over these past few years about how the negative things that people look at in their technology affect their mood. Right. Directly what you're saying. For example, several years ago, I started seeing reports in the medical literature about something they're labeling Facebook depression. It sounds like, really? That sounds very strange. Right. But it's apparently a thing. And what's happening is when people spend an inordinate amount of time on Facebook looking at all their friends, Facebook friends, posts, right? Because we don't know that's a real friend, but at least a Facebook friend. Looking at all the posts about what a great time they're having in their life, and they're going out and doing all these amazing things, and going on all these great trips and pictures. If people spend too much time looking at that stuff, what happens is they wind up negatively comparing their life to their Facebook friend's life, and this makes them feel down about themselves to the point where they literally can work themselves into a depression. Another aspect is the news feeds that people subscribe to on Facebook or follow on Facebook or
like
Twitter, right, any of these other social media platforms. When people just have the awful things that are happening in the world and all the negative and stressful events and politics and everything fed right into their phone, and they're looking through that all day, every day. That's just going to get them into some kind of extremely negative mental emotional state. Could
Right.
be anger, agitation, as well as anxiety or depression.
Yeah, it's a
So-
constant diet of bad news. Unfortunately, you know, a lot of people still delve into that, and it affects them, and it can trigger things and affect their mental health. So that's another great tip, you know, to kind of unplug
Right.
once in a while.
Right. Unfollow those news streams.
Right.
And just unplug from that stuff. It's too stressful. It's
Yeah.
too negative.
Give yourself a break. Again, we've been here with our host, Dr. Scot Bay of Psychiatry Today, doing a live TV broadcast, taking your phone calls live. So thank you for everybody that did call in. We appreciate it. If you want to reach out to Dr. Scott privately, do so on his website, nfbhc.com. That's nfbhc.com. Or you can give him a call, 678-822-0250. And Dr. Scott, thank you once again for spending the time with us. We appreciate it.
Not at all my pleasure. Thank you, Rick. And I appreciate everyone who called in, and hope everyone feels well mentally and emotionally. Remember, Psychiatry Today with Dr. Scott. We have our weekly radio show and the weekly podcast. And look for more of these TV episodes as well.
All right. Thank you again. And we'll talk soon, Dr. Scott.
Yes.
Thank you.
Thank you, Rick.